When acid comes in contact with your teeth, it destroys the enamel layer that's protecting your teeth, and that can cause toothache. Anytime you're having morning sickness, make sure you rinse your mouth thoroughly to wash out any of those acid and food particles, right? So it doesn't destroy the enamel layer of your teeth. What's up, beautiful people? Welcome to another exciting episode of Labor Room with your pregnancy partner, Dr. who you already know. Don't you ever forget that, okay? So today we're continuing from where we stopped last week. If you missed last week's video, please go back and watch it before you watch this one so you don't feel lost, right? You can find it in the description section, or just go to my videos, Labor Room, on the Labor Room playlist. It's there, okay? It's the latest video on the Labor Room playlist. Today we're going to be talking about changes you can expect in second trimester of pregnancy. So last week we talked about changes to expect in the first trimester, you know, being a new mom, your first time being pregnant. What are the things you can expect? And you know, I told you that first trimester can be such a drag. Like that first trimester, like I said, you'll be suffering and smiling. But guess what? After the rain comes the sunshine, and the sunshine is second trimester. Oh my gosh. In second trimester, you will forget that you're pregnant. Like pregnancy, what pregnancy? So then, like, when people start calling you, if you live in Nigeria, especially if you're in Lagos or something, whenever you're pregnant and you're telling me people call you Iya Beji. So in the second trimester, obviously your tummy will be getting bigger and bigger. So when you just hear people calling you Iya Beji, that's when you remember, oh, I'm even pregnant. So that's true, I forgot. Like, you won't even remember you're pregnant, but then people know you're pregnant, so they're treating you like a queen, treating you like a princess, giving you everything. One of the changes you notice in your second trimester, remember that I mentioned that in the first trimester your breasts start to get tender, swollen and fuller. Guess what? In the second trimester, the breasts continue to get bigger. So they continue to increase in size. They continue to become fuller. You might notice that you might need to change your bra, right? Because the one you were wearing before is no longer your size because your breast is now full. So you might need to go like a cup size higher or something like that. You might need to get adjust your bra straps to make it more comfortable for you, right? But the point is, because your breasts are bigger, you need supportive bra, like good support. If you watch my video on 6 things that lead to breast sagging, you will see that not wearing a supportive bra is one of them. So make sure you get a supportive bra. And just in case you're interested in causes of breast sagging and you want to prevent it, because you know you still have to look really good even though you're pregnant and afterwards, you can check out my video on things that cause breast sagging. But that's not the topic for today. So as I was saying, your breasts will get fuller, they'll get bigger, of course they will look nicer, and you'll be feeling like yourself, like, hey, is this me with my tiny breasts before? I'm afraid to myself, I now have big breasts. Wow. Everybody now wonder, what's the secret? It's pregnancy that's making your breasts look fine like that. So that's one of the changes. And yeah, depending on who you are, you might see it as positive or negative, but I guess most people see this as positive. Oh, by the way, in first trimester, remember I mentioned that you have nausea, vomiting. Guess what? In second trimester, for most women, morning sickness is over. You're now free. You've been released from the shackles of morning sickness and you're now free. Hallelujah, somebody. So you can now eat whatever you want, drink whatever you want, have a party without worrying about the food coming back up through your mouth, right? So that's a good thing. You now notice some skin changes. So another thing that happens in second trimester are skin changes. So you begin to notice some brown patches on your skin, especially on your face. It's called melasma. Some people call it like mask of pregnancy, right? So you start noticing that on your face. So one thing you should know is that those skin changes is happening because of an increase in melanin in your skin that is caused by hormonal changes in pregnancy, right? So one thing that makes it worse is exposure to sunlight. So anytime you're going out in the sun, right, because you know you are more prone to this, because you're pregnant, so you might want to put sunscreen to protect yourself from the sun, avoid staying too long in the sun, use umbrella if you have to, you know, just protect yourself from the sun so that those skin patches don't get darker, right? Another thing you might notice is that on your abdomen there's something called linea nigra, right? That's one black line that is going in the center of your abdomen, in the middle of your abdomen, so it's going vertically, right? So you notice that line is getting darker and darker as the pregnancy progresses, right? It's part of all the whole melanin increasing. After giving birth to your baby, that line is going to fade away gradually with time. So if you're not a big fan of that line, don't worry, it's normal in most pregnant women, but it's going to fade away after pregnancy. As your breasts are getting bigger, another thing you will notice is that the tummy starts to get bigger. Initially in first trimester, you're not really seeing any tummy. There's nothing. You're like, am I pregnant? The only thing that's reminding you that you're pregnant is nausea, vomiting, excess salivation, and all those horrible first trimester symptoms, right? But this time you see that your tummy is starting to grow, and trust me, it can be really exciting watching your tummy grow. Like, for those of you that are really, really slim, you can actually feel your uterus, that's your womb. You can actually feel where it stops in your tummy. So, and then measuring the growth. Like when I was pregnant, especially my first child, I used to take monthly bump pictures. In fact, what am I saying? Weekly bump pictures for every week. 12 weeks, 13 weeks, 14 weeks, 15. So I had everything because I was looking at the site, and it was so amazing to see the growth, like how the changes were going. It was really exciting, right? You can try that to take bump pictures just for your records. So also so you can show your baby later after a baby is born, right? Because they would like to see these things. So yeah, that's something fun that you can try for pregnancy. I mean, pregnancy is a journey. It's a journey that you need to enjoy, not endure, but enjoy. Part of the enjoying it is taking down the memories, soaking in every moment as it comes, record everything, right? So take pictures of your bump, keep it and all that. Show your baby later after your baby is grown up. You can refer to it, and you can even compare it to your next pregnancy and all that, So basically, your tummy starts to get bigger, and then this is the time when people start to know that, so you are pregnant. So this is what you've been hiding all this while. You're actually pregnant, right? That is when people start to see that you are pregnant. Your bump is small and it just gets bigger and bigger till it becomes so noticeable that you can't even hide it when you are wearing baggy clothes. Another thing that comes with second trimester pregnancy can be stretch marks. So you can have stretch marks on your breast, you can have it on your buttocks, you can have it on your thighs, you can have it on your abdomen. That's because, of course, you are increasing in weight. I mean, you are increasing in size and all that, so your skin is stretching, right? But you see that abdomen one, that one is so annoying. So in my first pregnancy, I went through the whole pregnancy, literally the whole pregnancy, and I had not a single stretch mark on my abdomen. So like 3 days before I gave birth, after I'd already finished making it, this stretch mark, I avoided it. I didn't even need to use cream or anything. Badass. The next day, like, I just went to use the brush when I wanted to take my bath. What did I see? Stretch mark from nowhere. I don't believe that was like 3 days before I gave it. Like literally after that I gave, I was like, why is this stretch mark have to come? Like I had already finished this dress. Why did you just have to show yourself? And those stretch marks, I'm not going to lie to you, they're so difficult to get rid of, right? There are many creams claiming that anti-stretch mark cream I can get rid of, but well, I don't know of any that actually really, really works, right? If you know of any, you can recommend in the comment section down below for people that might need it. But before you use any cream, make sure that it's approved by the Food and Drug Administration of the country where you live. Make sure it's safe for you, and make sure that there are no ingredients in it that you are allergic to or that you might react to. Other changes that you might see in second trimester. So you might have some dental issues. So because you are pregnant, your gums will become more sensitive. So when you brush them, it could lead to bleeding. So you need to brush your teeth gently, brush your tongue, brush your gums gently, right? So you don't expose them or make them bleed. If they bleed, just rinse it out with salt, warm water, okay? And another thing is, in the first trimester, you were throwing up a lot, morning sickness. And like I said, when you throw up, some of the acid in your stomach comes up with that food that is coming out. So when acid comes in contact with your teeth, it destroys the enamel layer that's protecting your teeth, right? And that can cause toothache. So anytime you're having morning sickness, make sure you rinse your mouth thoroughly, like rinse your mouth out thoroughly to wash out any of those acid and food particles, right? So it doesn't destroy the enamel layer of your teeth. Another change that you might experience in second trimester is sometimes you start to feel dizzy, right? When you are pregnant, right, your body, your blood circulation changes, your fluid volume increases and all that. So you might notice that you're feeling more dizzy, right? If this happens to you, avoid standing for long periods of time, because of course when you stand for too long, then you're exposing yourself to the risk of something called orthostatic hypotension, right? So blood is not able to flow back effectively to your brain, and then you start feeling dizzy. So you might want to sit down sometimes, stand, sit, right? But don't stand for too long. Remember, you're pregnant. So if anyone is sitting down on a chair and there's no chair for you, what nonsense? How can you be sitting when a pregnant woman is standing? Tell them to stand up for you and you go and sit on the chair. Okay, I'm just joking. Don't be rude, but I mean, it's just common sense. See a pregnant woman standing, you should be able to offer her your seat, right? And another thing is drinking plenty of fluids. That helps with the dizziness. And also another symptom that you have in second trimester pregnancy, which is leg cramps. Sometimes you notice that you're having leg cramps, like your legs is just crampy. So in that case, you want to be stretching your legs a lot, like stretch your calf muscles, stretch your legs, if you are sitting for too long, because I said don't stand for too long, at the same time don't sit for too long, stand up, take a walk, come back, sit down, take a walk, come back, sit down. If you're in a place where you can't stand up, like maybe you're in a long board meeting or you're on a flight or something, you obviously cannot stand, then just stay on your seat, but stretch your legs, keep stretching them, and bending them, stretch, bend, till the cramps go away, because those cramps can be really, really annoying. When you're in second trimester pregnancy, you might experience something that we call Braxton Hicks contractions. Braxton Hicks contractions are false contractions. They are not real. Remember that you're not supposed to go into labor until in your third trimester, the end of your third trimester, when you're around 40 weeks. So anything before that is preterm labor, and we definitely don't want that, right? So that's why it's important that you know the difference between Braxton Hicks contractions and real contractions. And I have a video where I talked about the difference between the two. In the video is called Guaranteed Signs of Labor, right? It's also in the labor room series. You can look out for it in the playlist, right? It's going to be somewhere in the playlist, one of my first videos, so you should definitely watch it, because you need to know the difference between the two, right? So that if for any reason you're having a real contraction in your second trimester, you need to get to the hospital immediately, right? But if it's a false contraction, then that's okay. So one of the things, let me just tell you some of the differences. A real contraction, right, is usually painful, and the pain increases in intensity. But false contraction, Braxton Hicks, they're not usually painful. You can feel it, but it's not painful. If you're still eating popcorn and shawarma while you're having contractions, then that's not a real contraction. Then another thing is, real contractions are regular. They happen in a regular pattern. So you can have one now, and then you're having one in the next 5 minutes, and then in the next 5 minutes, they're actually regular in their pattern. They have a regular pattern. Braxton Hicks, you can have one now, have one 10 hours later, have one tomorrow, have one 2 days later. It's not regular, so then you know that it's not real. Another thing is that with Braxton Hicks, when you change your position, the contraction stops, right? But with real contraction, if you like somersault, sit down, stand up, roll on the floor, that contraction will be there till it's ready to stop. So if you're having that small contraction and then you just change or stand up, sit down, and it goes away, then that one is not a real contraction. That one is child's play. Is Braxton Hicks. So it's important that you know the differences, right? But just in case you notice you're having real contractions, please rush to the hospital so that something can be done about it, because we don't want preterm labor, because that will lead to preterm birth, right, and other complications that we're not going to talk about in this video, because that's not what it's all about. Next week, we're going to be talking about the changes to expect in the third trimester. If you enjoyed watching this video so far, don't forget to click the like button, subscribe, and share with anyone you think I need to see this, especially any pregnant woman make sure you send this video to them. Send it on WhatsApp, send it on Telegram, send it everywhere. No pregnant woman should be on the surface of this earth without watching this video. Like I always say, every pregnancy journey might be different, but your pregnancy partner, Dr. O, remains the same. See you next week.